Hi guys, it's me, Professor D, and welcome back to my channel. If you haven't done so yet, please be sure to press that like and subscribe button below to keep the videos coming. Today I want to cover delegation with you. I find that nursing students, even those that have graduated and they're ready to take their boards, they tend to have a hard time with that. So I want to kind of break it down so you can have a clear understanding of what the RN must do. The RN has to keep these type of patients. They can't delegate it to anyone else. And what they can delegate, to the LPN or the CNA. So let's get started. RN. The RN must keep any patient that requires an in-depth assessment, okay? Any patient that needs an in-depth assessment, the RN is going to keep. And let me explain that to you. Why am I saying in-depth? Because as nursing students, you guys tend to get this confused and you think that only RNs can do assessments, which is incorrect because LPNs can give meds. Do you think LPNs just give meds without assessing the patient? No. You know, if they're going to give an antihypertensive, they're going to take the patient's blood pressure, which is an assessment, right, before they give the medication. So LPNs can do assessments. Here's the key. They can't do in-depth assessment, and that's the difference. So what is an in-depth assessment that only the RN can keep? Any patient that is new. And when I say new, that means the patient is new. The patient just came up from the ER, from the emergency room, right? The patient just came from OR, the operative room. Let's say you had that patient and they had to leave your care to go for a diagnostic test. They had to leave your floor and they came back. Guess what? That patient is considered new. Why? You don't know what happened to that patient when they went and got that diagnostic test. Imagine the patient went and got a diagnostic test. They were allergic to shellfish. We didn't know that. They went and got contrast media, and now they're coming back to you with all these signs and symptoms of an allergic reaction, right? So any patient that is either new to you or they left your care for whatever reason and they're now coming back, they're going to require an in-depth assessment, okay? So the RN has to keep that type of patient. Who else does the RN have to keep? Patients that require extensive teaching. Why did I say extensive? Well, LPNs teach patients, don't they? Before they give a med, don't they teach the patient? You know, remind that patient about the med, but in-depth, which means if you get admission, that's the first time you have that patient, you're going to have a lot of teaching you're going to be giving that patient. If it's a new medication, there's a lot of teaching you're going to be giving that patient. If a patient's about to go to surgery, there's a lot of teaching you're going to be giving that type of patient. So any patient that requires in-depth assessment, in-depth teaching, the RN is going to keep that patient. Who else must the RN keep? Blood transfusions. LPNs cannot do blood transfusions. LPNs are allowed to do IVs, but they're not allowed to do blood transfusions. So if it's a blood transfusion, the RN has to keep. Who else? Central lines. The RN must keep central lines. Why? Because the patient's so at risk for infection, right? So if a patient has a central line, they're going to require a what? In-depth assessment that only the RN can keep. What else do we have on here? Piggybacks. Only the RN can do piggyback IV medication. Only the RN can do IV pushes, right? So LPNs, yes, LPNs are allowed to do infusions, but never pushes. They are never allowed to give anything that's a push. PCAs. LPNs cannot do PCAs, only RNs. Okay, the RN is the one that sets up the PCA, the patient-controlled analgesia, and only the RN can continuously monitor that patient on the PCA. Let's see what else we have. Care plans. Only the RN can start the care plan or make changes to the care plan. The LPN follows the care plan, but the RN is the one that initiates the care plan and makes changes to the care plan. Referrals. The RN doesn't write the referral, but the RN is the one that's responsible for asking the doctor for a referral. And when I say referral, what does that mean? Let's say the patients, the LPN or the RN's caring for a patient, and they notice that, patient seems to not be swallowing well, it's the RN that's responsible for calling the doctor and say, hey, can I get an order for a speech evaluation? Or if the patient's going home, can I get an order for home health? Or can I get an order for nutritional therapy or physical therapy or occupational therapy? Any referrals, the RN asks for that, okay? So we have in-depth assessment. We have in-depth teaching. We have blood transfusions. We have piggybacks, IV pushes. We have PCAs. We have care plans. Caustic meds, that's our next thing. Any medication that is caustic. What does that mean? That means if it infiltrates, it comes out of the patient's vessel, it can cause death to that surrounding tissue. Only the RN can give those type of meds. And the perfect example of that, guys, is chemotherapy meds. That's why, these chemotherapy meds, number one, they're caustic. And number two, those patients that are on chemo, they're going to have what? Central lines. That's why only the RN can keep those type of patients. Okay? And lastly, the most unstable patient. If you have a list of questions, a list of situations, and they ask you which one is the RN going to keep, whoever is the most unstable, that's who the RN is going to keep. The RN can never delegate to an LPN a patient that's not stable. Okay? So we talked about RN. Let's talk about LPN. What kind of patients can the LPNs have? And you guys seem to think that, I don't know why, you guys want to treat LPNs like CNAs, and there's so much that the LPNs can do. So let's talk about what type of patients the LPNs can keep. The LPNs can keep the most stable patient. The LPNs can give routine medications. The LPN can give IV infusions as long as it's not a piggyback, as long as it's not a caustic medication, as long as it's not a push. LPNs, guess what? They can take care of patients that are on vents, patients that are trach. Absolutely. LPNs can do vented patients. They can do trach care, patients that have PEGs. LPNs can do, let's see what else I have on the list. Ostomies, NG tubes, urinary catheters. Basically, those patients who are stable, the LPNs can keep. So there's a list of type patients that the LPNs can keep. If it's not on the list for the RN that I gave you, the LPN can have that type of patient, okay? Let's talk about the CNAs. What type of patients can the CNAs have? And I want you to think of this and just keep it as a rule of thumb. Anything that requires critical thinking, the CNA can't do, okay? So the CNA can't teach, right? The CNA can't assess. The CNA can't give medication, because all of that stuff requires critical thinking. What the CNA can do is ADLs. They can give the patient baths. They can change the patient if they need to be changed. They can brush their teeth. They can feed the patient. They can walk the patient. They can transfer the patient from one part of the facility to another. Now let's talk about transfers. The CNA can transfer the patient if the patient is stable. If the patient's not stable, the RN is going to have to transfer the patient, okay? The patient, the CNA is allowed to pick up medication from the pharmacy and bring it to the nurse, because all they're doing is transporting medication, right? They can transport blood, because all they're doing is taking it up from the pharmacy to the nurse, or the blood bank to the nurse, excuse me. They're allowed to take vital signs. They're allowed to record and report, which means they're recording the vital signs and they're reporting it to the nurse. They're allowed to check glucose levels, okay? They're allowed to use a glucometer and check the patient's glucose levels. That's recording and reporting, and they can report it to the nurse. So there are lots of things that the CNAs can do. So I'm gonna have this list up. I want you guys to take a look at it so you guys can really be clear about the role of the RN versus LPN versus CNA. And I want you guys to keep something in mind. The RN cannot delegate anything that they have to eat, EAT. Anything that requires for them to do an assessment, for them to teach, for them to evaluate. EAT, E is for evaluation. A is for assessment, and T is for teaching. Anything that requires the nurse to evaluate, assess or teach, they cannot delegate to anyone. They have to keep those type of patients, okay? One more thing I want you guys to keep in mind, if you have a question about a brand new nurse, a nurse that is newly licensed, a nursing student, or a nurse that's floating to your floor, you're going to treat these three as LPNs, which means you're going to give them the most stable patient, okay? So I don't want you to get tricked. Even if they're an RN, I don't care how long they've been an RN for. If they're floating to your floor, you're going to give them the most stable patient because they're not used to your type of patients. And the only exception to that rule is if you happen to have a patient that matches the floating RN's background. So for example, if you're working on a post-op unit and you have a RN floating to your floor, but they're floating from the ER, right? And you have a gunshot wound patient, even if your gunshot wound patient isn't the most stable patient, because that gunshot wound matches the background of that patient that's floating from the ER, guess what? You can give them that patient. Otherwise, a floating RN, you're going to treat them like an LPN and give them the most stable patient. A new grad patient, yes, they have a license, but they're newly graduated, they don't have experience. You're going to treat them like an LPN, and you're going to give them the most stable patient. And lastly, so I have the RN that's floated to your floor, the new grad, and RN that floated to the floor, new grad, nursing student. A nursing student, you're going to give them the most stable patient and you're going to treat them like an LPN. So I hope that kind of clears things up for you as far as delegation is concerned. If you guys want to practice, please, I encourage you to watch my delegation video. I go over quizzes. I go over quiz questions about what you're going to give to the LPN versus the CNA versus what you as the RN would keep. So if you want to practice, be sure to watch my delegation quiz video. Please do not forget to like and subscribe to keep the videos coming. Thank you, and I'll see you next time.